Hey guys, today I thought I would make a video really quick before I go to work and let you guys know that I passed my finals for 104 and Pharmacology, and I passed the classes as well. And I thought I would give you guys a rundown on what we learned in those classes this term. 104, we basically learned head to toe assessments. We learned how to start at the top, literally work your way all the way down their body and check for any masses or, skin lesions, any kind of neurologic disorder, all that good stuff. And we also learned how to auscultate the bowel sounds in all four quadrants, the lung sounds. We learned how to find the apical pulse and take the apical pulse for 1 full minute. And we had a concept mapping project where we had to choose a family member, loved one, husband, whatever, and do a full head to toe assessment and come up with 3 nursing diagnoses, which is another thing we learned, the nursing diagnosis. You basically have to make a fancy sentence for a medical diagnosis. So like a nursing diagnosis sentence would be like risk for infection related to open wound manifested by serous-inguinous drainage. And then, a doc would come in and say, oh yeah, that knee's infected. That's pretty much a fancy way of saying infected knee. And it took a while for me to grasp that concept because it's easy to just diagnose someone with like, oh, you have pneumonia, oh, you have chicken pox. But we're not allowed to do that. We have to literally write out fancy sentences like that, and then the doctor would come in and assess them and figure out, oh, hey, yeah, you're right, it's chicken pox. We learned how to chart on the MAR. We learned how to chart on the nurse's notes, doing subjective and objective data. That's pretty much it for that class. We spent skill time just doing head-to-toe assessments, learning how to be comfortable around each other because we're going to be around other people, but I kind of don't have any issues being around other people and touching them because I do that daily as a CNA anyways. And as far as Pharmacology 2 goes, we basically learned antidiarrheals, anti-emetics, emetics, antibacterials, antivenins, and we learned a bunch of drugs this time, but all the drugs we learned in this farm basically help you when you have an infection, a cold, or some type of disease. We also learned the anti-neoplastics for cancer, all the hormone drugs like growth hormone. It was just, these classes, you really had to focus and really pay attention. Like the other ones, yeah, you pay attention and work and keep your head in the books, but these, we were really studying hard as a class. We were trying to help each other pass. I don't know if everybody passed today. We got out around 12:30, but we'll find out Monday, because Monday we start 105. I'm not sure what that entails. I'm going to pick up my textbooks for that class tomorrow. And we also start clinical on Tuesday. We're going to be at 2 different hospitals. I don't know how they're going to set up the clinical assignments for that, but I looked on my countdown on my phone today and I have 289 days until I graduate from LPN school, and I'm so excited. I love it. You find out what you like when you find your niche and what you really want to do in life, and then when you start doing it and you realize that your goal is getting closer, it's like, yes, that's all the motivation I need is just that 289 days. Then I'm going to take the NCLEX, hopefully pass the first time because it's expensive to pay on your own. My school pays the first. Hopefully I pass it, and hopefully I'll get a great job doing something other than geriatrics. I've done geriatrics for 3 years, and there's so much more out there. Not that I don't love what I do, but there's just so much more out there. I'm ready to get out there and explore my opportunities and start getting the ropes of being an LPN and eventually go back to school for my RN and my bachelor's. So if you guys have any questions or comments, as always, leave them, and as soon as I have a chance, I will get back to you.